Well, good afternoon, and barring a special meeting, welcome to the last meeting of 2025 of the Davidson County Board of Health. Thank you for your time coming in. Hope everybody had a good Thanksgiving and families are well and everything, and looking forward to another holiday with Christmas coming around the corner. So get your shopping done. I like gift cards. No, just kidding. Well, good. Anything other? Okay, good. Then we'll move on to our first item, which is our agenda. So everybody had a chance to look at the agenda, today's agenda, and any discussion on changing or amendments to it? I'll need a motion to approve the agenda.
Motion to approve.
Mr. Kessler, and a second.
Second.
All right, all in favor?
Aye.
Any opposed? Good. I didn't see any for public comment.
No, sir, no public comments were received.
Next, item number 4, we're just going to approve our consent agenda. Any discussion on what was already sent out to us and
Just a reminder, we have the minutes from the previous meeting because we did not have a quorum. We were adding August as a carryover.
Okay. Good. All right. And a motion to accept the consent agenda.
Motion to accept.
And second. You for that. All right. And number 5, Mr. Kessler, from the commissioner side, do you have anything
Short and sweet. I don't have a thing.
Thank you very much. And then moving on to our always wonderful health director and her reports.
Well, thank you, sir. Several things I want to talk to y'all about. We are currently recruiting, and it's in italics because we are on a data freeze. And I don't know if that was clear to everyone. I just want to remind you, since the middle of October, we have been unable to hire, promote, told not to fire anybody because the county's going through a big data overhaul with the way that we do our onboarding and our timesheets and things like that. And with that overhaul, after October 18th, they were going to have to manually enter everything when it opened back up. So we've been on a freeze. So we've not been able to recruit for any positions, which has put us in somewhat of a bind, but we're making do with what we have. We've had one resignation during this time, and they were able to process that. But we're just holding on several positions. So the ones that we're recruiting for, we're kind of not really because there's no positions posted. The data freeze will end after December 18th. And then anybody that wants to work in Davidson County government will have to reapply, even if they've applied previously, because it's an all new system. So we won't be able to pull old applications and do that. So we have not had positions posted since really the beginning of October because we didn't want to have people apply and then call them back and be like, you applied, but now we need you to reapply. So hopefully as soon as we get those back up and running, we'll be able to hire someone pretty quickly. Belinda has taken on a new duty, and I thought that y'all might be interested to hear about this. And I hate Randy's not here because this is really an on-site thing, but we have a system called LDO. We used to joke and call it LD slow. It is like a really old way of doing environmental health records. But some of the records that are in there are only in there, and we're trying to get them into our new system. We also have paper files that are great if you need them on paper, but if you want to go online and check on your property, you won't see your records. So Belinda has started helping with this process because it was on the young ladies who work in environmental health, but they're just so slammed down there, they've not been able to do it. So Belinda went through a training session, and in between other duties, Belinda is working on that, which is a huge help to environmental health and to our community because now we'll have those records for people to be able to find them online. So huge thanks to Belinda for taking that on. Last week we had the 2025 EB5K wellness event. It was right here in the parking lot, and there were about 650 people here. And Jana Walker at the end of the table was like rock star volunteer, making sure everything went really well, and it was great. So that is an event that started in 2010. It is a wellness event for the county. We do a lot of different things than a typical 5K because you can donate canned food. So you don't have to pay to register. You can do canned food donation. And that's how we get so many people Thanksgiving morning. Like I said, we had about 650 people. So it was a big day. And then the United Way gets all the proceeds. And I think they'll get over 10,000 this year, probably. That's a big year. So it's a really good event. And the pastor's pantry emailed us today and they got 2,500 pounds of food from us. So it's a really good time to replenish their shelves after the Thanksgiving holiday. In case you can't tell, she's covering her belly, but Corinne is very pregnant. And so we are preparing for our business office changes. With Corinne being gone, it is going to be a challenging time for our team, especially because Corinne's right hand in the business office resigned 3 weeks ago. Is that right? Yeah. So we are at a major deficit in our business office. However, the county manager and the commissioners have been incredibly supportive. You got there. And they have allowed us to use some lap salaries and other dollars to hire a contractor to help do all the budgetary work. Corinne has been trying to train me and another staff member a little bit in what she does, but it's just, I mean, her job is a 45-hour-a-week job as it is right now. And so trying to find someone else to do those duties with their jobs is really challenging. So the commissioners have already approved the moving of some money into our contract line. And then we have another, at the next meeting, there's a alliance contract, and we're going to be able to pull a retired employee. So to come back, the position that Corinne filled was vacated by Janie Ainge, and she'll be able to come back and work with us. So this will be a smooth transition. So hopefully Corinne will enjoy baby and not worry about work, and things will run smoothly here. I did want to let y'all know the opioid settlement committee did not meet for the last scheduled meeting, which is not something I typically update y'all on, but I did receive a call from a community member who was really upset that we hadn't met and let me know how upset they were about it. And I just wanted y'all to know, as the public health director, I'm on that committee, but I most certainly am not the chair. I'm just a member. It seems to sort of, well, the chairman is a co-chair with Commissioner Shell and Commissioner McClure. But the majority of the business is really run through the county manager's office. So I just am in equal footing, but the gentleman called me and wanted to let me know how upset he was about it and upset the fact that we've not really spent any money. The opioid settlement committee has only earmarked funding for the jail MAT program, which is the Vivitrol program that we're doing through the jail. And they've also earmarked money to support care management staff for that, but that's it. And we've had a lot of people come to the meetings wanting us to support other initiatives that are going on in the county, things like more Narcan access, things like housing for people who are incarcerated or substance abuse affected and things like that, but we've not spent any other money. So when we didn't meet the last time, that sort of got this guy upset and gave me a phone call. So I wanted to let y'all know the meeting was canceled. Hopefully we'll have our next meeting and we'll continue to work towards allocating these funds in a way to help combat the opioid crisis that we have in Davidson County. Our programs, we were thrilled to see the end of the federal shutdown. That was making us a little squirrely about several of our funding streams, but all of that has been worked out. Rabies cases continue and it's equal opportunity. Since our last meeting, we've had a fox, a skunk, and a raccoon. So there's no rhyme or reason to the rabid animals that we are seeing. The raccoon that came in had gotten entangled with a pet that was not vaccinated, so that pet had to be euthanized, and that was unfortunate. But that's just what happens. The dog had come up, the people were like, oh yeah, we're gonna keep it. No history, no microchip, anything like that. They had planned to take it to the vet the next week, and then the skunk got involved, and then that didn't work out well for that dog. So we are preparing for the new workday system, which is what I was talking about with onboarding and recruitment. And then our health promotions team was thrilled to have a great success with the photo library project, and we will be sharing those photos. They're sort of culling them down. How many was it?
They took over 2,000 photos with us and they sent me probably over 300. And then there were some additional edits that they needed to go back and make it. And then we reviewed them as well. So I'm waiting for their final, but we got some really cool pictures of staff out in the field, and in action here in the office. So I'll be excited to share those.
We'll be able to use those for promotional materials. We're hoping to put them on the website and things like that, just in different ways. So instead of using canned photos, we'll have actual staff photos. And, our team, I don't know that anybody really prompted them to do this, but so many of them wore Davidson County logo gear. So it was a really good look for them. Did we tell them to do that? Oh,
I didn't tell them they had to.
There you go.
Just a reminder, if you couldn't come up with something to wear that
Right.
you
Yeah, smart. So good job. And then Stacy worked really hard on getting our QA policies for environmental health submitted to the state. That was a new part of the North Carolina General Statutes this year that we had to do all these QA policies. So Stacy worked with our preparedness coordinator and QA policy staff member, and then was able to use some canned things that the state provided, so we'll be legal with that. But that was new for us, general statutes requiring quality assurance. So we got that thing submitted. Mr. Chairman, that's my report. If there's any questions, happy to take.
No, but I was gonna bring up that I had recently read an article about the domesticating of raccoons. And yeah, they coming out of our garage all the time where I'm at. And I look at my cats and I go, get them out of here. Why do you do this? No, they don't. And so that might be one of the reasons a rise of some of rabies cases possibly.
Perhaps. The ones that we've come across have all been wild ones. But in North Carolina, I believe it's still illegal to have a raccoon as a pet. So
they're inadvertently mine apparently.
Yeah. You feed them their yours, right?
That's right, yeah. Well, thank you very much. All right, we do have one bit of old business to bring back up, and it was the letter that we had spoken about in a past meeting to give our to possibly give to our county representatives, our two representatives, and our senator. So it's on it's in your it's on page 40. Did anybody read over that and have any new questions about that? Any discussion to move forward with sending these? I think it's a well-worded letter. Obviously, I'm signing it, but I had a lot of good input. So I'd like to go ahead and throw it out there. It's more, I think it's an awareness letter. It's not a call to action letter specifically. I think our three representatives would be more happy to know that it's our concern and at least keep it on their we're saying the Army on the 50-meter target list so they can attack it if they need to in a way. So that's my 2 cents worth. So I'm all for moving forward with it. Any other discussions?
I think it's well stated. Do we need a motion to show support from the?
We would, yeah.
Board?
See if there's any more discussion first about it. Any changes of it that you didn't like or?
I thought it was well written. I remember reading it.
All right, then, yeah, more than happy to entertain a motion.
I move that we go forward with the letter. Second, it's written.
Sounds good. All in favor?
Aye.
And any opposed? Great, we'll get that out as soon as possible. Thank you for that. Now some new business. We have some information on the patient portal.
You may notice that Angela Gray's not here. She was going to try to step in if she could, but we had some shortages today. And you know how it is when you're the supervisor, you're the one that covers. So she's covering for the lab today. So I think that she's in the lab right now doing work. So I think Corinne and Mary Lou have sort of agreed to go over this patient portal that we have now. And it's just a brief report.
So what this is just when we started and how many patients signed up. The patient portal is required. So we didn't have a choice whether to do it or not. We had to have access for patients to have access to their records whenever they needed them. So we did finally get that set up, and about 20% of our patients are using the portal now. We see a lot of folks that want immunizations. That's what they're wanting for college or school or their job or something. So they want stuff like that. But overall, we've just not had a lot of people just knocking our doors down to get it. But it's new and we're doing education when they come in and even till when they leave to make sure that they understand if they want it, they can have it. So it's available. Any questions? I think we all probably have patient portals with our own stuff, but it's very similar.
That Cure MD, is that something that we buy it specifically for us,
Yes.
for our health department?
Sure. It's not like in Wake or Novant or anything. It
Okay.
doesn't communicate here.
Okay.
All right. Thank you. Thank you very much. All right. Now moving on to some good old debt.
Tabitha did present on this at the last board meeting, so I'm just doing a watered down version. We present this to the board every year, and it does require an approval for us to move forward with anyone we are submitting to debt set off. Thankfully, our staff at checkout have worked really hard to send out annual statements on a quarterly basis, which really helps us get payments in and avoid sending people to debt set off. We did not have any bad debt to write off this year. That is a patient balance of $49.99 or less, and no payment made in the past year, so none to report for this year. Debt set off is a patient balance of $50 or more. It comes with a list of stipulations. They can't be under 18. They have to have received 3 statements and a letter saying, hey, this is the last chance. We're going to be sending you to debt set off. And with board approval, we do have one account that totaled $230.08. That person has not made a payment in the last couple of years.
When it comes to the,
Can somebody explain what debt set off is?
It's a program. So essentially we report the patient to this program and they garnish wages from tax returns. The local health departments are kind of at the bottom of the barrel. So it usually takes quite a bit of time for us to see any of these collections because they're doing those big hitters before us. But it's a state program that we submit them to and they kind of configure it all for us.
So it's collections, basically.
Mm-hmm.
And then if it's under $50, you just write it off.
Yes.
That kind of the policy.
And I mean, they can make a 50-cent payment and we say, great, you made a payment, continue to do it. We have worked really hard that would avoid sending them to debt set off. We try to avoid doing that. So we have payment plans that we offer patients. We're sending out those regular statements. And I will say we've gone from thousands and thousands to $200 from one account. So we do give lots of opportunities.
And that patient, are they still seeing? Are they still coming in for services?
I don't have that information offhand. When we look at it, we just make sure in the past year they have not made a payment. So I can confirm that.
what is our usual policy on that? I mean, they come for service that's maybe not emergent or urgency. They have a balance like that.
We at every visit they come for, whether they have a visit that they have a fee for, we do let them know they have a balance and ask if they want to make a payment. If they're not already on a payment plan, unfortunately, the system doesn't allow for, like on Novant, you can set up automatic payments to kind of withdraw. That's not something our system supports. But every time they come in, we do say, hello, you have a balance. Would you like to make a payment?
The general statute is that we cannot deny service to anybody that cannot pay. So that's where that comes in. They can come in for services, for your question, and not be able to pay, but we can't deny them because we are considered a safety net for these services.
Yeah, and I think maybe it's just my private industry impact here, but Jason, if you had some $230, would you turn them over to collection?
That's right. And I'm sitting here thinking the same thing.
Yeah.
Why are we, does it cost us anything for debt set off?
No, And I'll be honest, my employee that resigned typically took care of this thing. So I have some information that I might be lacking. But we do it annually and we're required to at least report it annually.
But we've paid somebody to send them a letter. We've
Right.
paid postage for 2 years, you said?
I can't confirm how long they've been on the list, but they haven't not in the past year, because that's what we look for this current report.
Yeah, Jason's point is that if we're spending money to try and collect a $130 debt, so we'll continue spending money. Typically collections, you get like half of what actually gets collected if you do. To me, like, just seems like you're making a whole lot of trouble when you should just write it off. I don't know if that's an option, but that's how I would handle in my business.
Exactly.
Well, it may be that this one's 230, but it could be 10,000.
Yeah, 10,000 is a different
Yeah.
calculus, right?
If there were enough money to go after, 100%, but I think we're gonna,
But you gotta have it either way, right? I mean, you gotta have it whether it's 10,000 or 230.
Right now, the standard is write-off, $49.99 or under. Set off above that, but there's no intermediate, like you were saying. I mean.
Yeah, and I,
But you don't want somebody that owes $230 to say to somebody else.
Oh, yeah, don't worry about it.
Right, yeah.
Do anything.
Don't worry about it.
I will.
It's always an example to be
Compared
made too.
to history, what it used to be. And I think that is due to our staff really talking with them every visit to say, hey, you owe, I mean, even if you can pay $10, I mean, we do have people that'll come up and just pay $5. And that's over time. When I was here, I mean, I've been here a long time and it used to be a lot more. Cause actually I used to do the debt set off and all, years ago, and it was a lot more. So this really looks good. So to your point, I get it.
Yeah.
But it used to be worse, so it might be taking
And-
looks at it.
If the person comes in and makes a payment, we reduce that in debt set off.
Sure. And I just,
Yeah.
like my parents run a medical practice, right? And people can't make their $3 Medicaid copay, right? And, do they turn them over to collections? No, right? If they owe $1,000, I suspect they do. I will tell you in practice, if you turn that person over to collections, the entire family finds out about it. And it seems like a lot of drama for the possibility of collecting $230 or less your administrative costs and less your administrative time.
I think I have a couple questions that we need to follow up with y'all on from what I'm hearing today. Number one, is the threshold of $49.99 a Davidson County thing, or is that some other standard that we could look at maybe increasing? And then how frequently are we mailing and making contact, and what's the administrative burden to get to the debt set off before we write it off?
Yeah, well, Lillian, I can tell you that this debt sounds like it's several years old. They haven't made a payment in a year. They don't intend to pay it. And turning them over to collections probably is going to have a pretty low batting average. And I'm just concerned that I've got a staff that's pretty stretched thin right now, and you're just adding work to them with no return.
So it's been low
It's
for
been low
several years.
Several. I would,
One more informational item is, are those certified letters, are we knowing they're getting them? I mean, there's another cost associated with it, but I mean, I just don't know that it's.
The quarterly statements are just regular postage. They're not certified. The actual notification letter would be certified.
So they're getting that.
And that one's just sent before. We do also give them
Exactly.
30 days after receiving the debt set off letter to make a payment and potentially not be sent to debt set off as well.
and that happens too. They'll get that thing from debt set off and they'll come up here. How can I keep from, and then they pay their bill off.
But the way the debt setup works is that if somebody has a tax refund, that can get grabbed, or if they win the lottery, that can get grabbed, or I guess maybe certain other things where the state gets money for that person, it's identifiable, and then they, instead of giving it to the person, they give it to the agency or whatever that has put in the debt set off request.
Correct. So I'm familiar with that. Basically, there needs to be, let's ignore the lottery scenario. But basically they need a state tax refund where the balance can be applied against that, and then they get some lesser amount of their refund.
Is there a fee when y'all turn them to debt set off? Is there any fee to us, cost to us? It's a state program. Okay. I could see if it was like a business where I have to pay a service to do collections and they
take a
charge me a $15 ticket every time where they take half of it. I could see that, but if it's free. I click a button and send it to them. You got a lot better chance of collecting it that way than you would a collection agency go after. A collection agency, they'll ignore that because they're usually pros. They don't care. Their credit's already crap anyway. They got their money coming back to them. So that's more sure thing. So I don't see an issue with it.
Once you send it in to debt set off, it's kind of off of your books at that point for the most part.
If they come in, it's marked in their patient profile that they've been sent to debt set off. And if they decide to make a payment against that balance, we then go in and reduce the amount reported to debt set off as well.
Another question that I think I need to look into, and will take some time, is what is the return on investment for our previous debt set off, and just let y'all know what that looks like over a 5-year average.
It was reported at the last meeting, I didn't write it down, that in the last year we had received close to 2,000 off of collections in the last year.
Thank you. I did not remember that.
So today, our course of action then is to stay the course as we do now, or table it and see if there's something different. I want to go ahead and say that I like going to war with the armor we have. So we move forward with this and then look into how we handle it later.
Forward.
Okay.
That would be one option, one course of action. Because this is just set the way we've done it before. We do it every year, and then we can maybe put on the agenda for the first meeting, maybe of the next of next year. Whether we should raise the threshold of the $49.99 and get some good discussion on that after. Maybe find out a few more pieces of information. That's just on the table, though. I just wanted to put that out there.
So I think what you just said is go ahead and turn this into debt set off. Let's find out some more info and figure out how to handle future cases.
Yes.
Yeah.
I'll put that on the table for a motion to have the debt set off as is for that 230.08. It's up there.
Is that your motion, Dr. Early?
Yes.
Okay.
Sorry.
So we'll just need a second.
Second.
Okay. And all in favor? Worthwhile looking into.
We'll add that to the new business for the next meeting agenda.
All right. Item number C in new business is some strategery, as one of our presidents used to say. Yeah. So, Ms. Walker, if you don't
All right. So this is just a quick update on our agency strategic plan. Love that everything now can be like communicated with emojis or whatever. So things that we're working on here across the agency over these a couple of years, as far as quality improvement and customer satisfaction. Improving the client experience and satisfaction were something that we wanted to address. Some things that we have completed is a revision to the survey that we offer to all our patients and participants who visit us to implement the patient portal, and also to provide information and education for the public while they are waiting in our lobbies. And so all of those things have been completed and are moving along. We have several things that are kind of in conversation there. And then just one item that we haven't really gotten started on yet, but hope to in the next year. As far as workforce development, things that we wanted to address, of course, were employee retention and job satisfaction. So something that we've already got completed. We are using our newsletter, or an internal newsletter, and then also we have TVs in the break room to put information and content on those to engage staff. Some things we're working on trying to find some interactive ways to, poll staff and do some fun things that way. We've also are looking and having conversations about other ways that we can get staff together and look for opportunities for engagement with each other. Then the other goal we are looking at is promoting public health careers so we can keep a good pipeline of workforce. And a lot of these things are ongoing, as far as, it's going to take continued work. So we've started with our public health career materials. We revised all of the nursing materials. It talks about the different jobs that we have here, the individual pathways to get those jobs, education requirements. And so we've got little postcards, and also like a one-page flyer with all of them. And we're slowly working our way through all the different careers here at the health department. We're working on environmental health right now. But we hope to take these, materials that we develop and get those on the website, take them to job fairs, high schools, career days, things like that. And so anything we can do to help spread the word about public health careers. So most of that is in ongoing, in action, but I don't know that you can ever give something like that a green check mark when there's always work to improve. Okay. And then if you want to go to the next slide. Yep. Communications, the external communication. So how we communicate with the public. So we want to increase our online presence. We know that folks, are attached to their screens and their devices. And that's something that's continually evolving. So how we share education, outreach materials, that's something that we will continue to work on. And then our internal communications, how we talk to each other here within these walls, and, make our staff feel connected. And that really ties in with our workforce development as well. But we are looking at, now that we have Microsoft Teams, can we set up channels and things like that for staff to be engaged and get folks updates. Our internal H drive, where all of our shared documents have lived forever. Anybody that works here knows if you open it up, it is like, oh gosh, where do I find something? It's a mess. And so things like that are going to be goals to helping staff feel more in the know and not so lost. So those are things we're working on. And then community engagement, ongoing conversations, and then some things that are in the process, but being more visible in the community as far as what our services are, and also education that we can provide from all divisions. So that's kind of where we are. A lot of things are in process, and always room to improve on. So we'll keep working on this.
All right, any questions or?
The expansion to family planning, what does that look like?
Well, service hours, things.
More evenings possibility because working folks coming after 5. We're hoping to do a little bit more than that. We do once a month, twice a month now if there's a 5th Wednesday. But and then had our provider position posted, but it's down now. So once we get that up, then we'll probably look at that a little bit closer because I don't want to expand and not be able to see people about the provider. So
I need to be open if you don't have a provider.
yes. Yeah.
All right. Thank you very much. All right. Next, we need to discuss our upcoming year meetings. These are the first one of each month as we of the months that we're going to be meeting. Of course, in parentheses there with in April is Easter Monday. Be the day right after that. Just that's the only one that I thought would jump out. If anyone usually has plans there, would like to bring up something about that we could discuss and change. But otherwise,
We will make a motion.
okay.
Is there a conflict in this stuff?
I will not be available on March 3rd. So I apologize, and we can totally have the meeting without me, but that's also the one where we usually do the budget, right? Yeah, and Corinne won't be here either. So that one could be challenging, and I'm sorry, but it is a preventative healthcare. I have a colonoscopy and I have family history and personal history, so I'm not pushing that appointment out. That's when they keep, and so yeah, I don't play with that one. So that's why I will not be available that day.
You'd rather be here though.
I'd much rather be here, but
Come right after,
I probably need the rest of the day just to, yeah.
Could we look at moving that one to maybe the week later?
March 10th would be fine for me if that would
Would
work.
there be any conflicts with anyone? Do you? That I know of.
As far as
3:10. Who knows, right? But still.
Okay, before we make just that one, change and move on it, any of the other ones that anyone has any conflict with, my colonoscopy is not, no, I'm just kidding.
But I tell everybody loud and proud, like, there's a good reason I go every 3 years, like, get them this important.
Yes, absolutely. You're well worth the delay.
That April 7th meeting, I mean, Davis County schools are closed. I won't be here, without a doubt, but
Well,
I don't like it after Easter Monday
Yeah.
either, to be honest.
if that's moved, we're kind of keeping the same kind of spacing between them. If we wanted to, is that 14? No, 7, it says 14.
Maybe to the 14th, is that what I'm saying, in April? Yeah, that's fine. 4/14.
All right. Yeah, it was one more week of my birthday, but yeah, it'll be okay. Y'all can celebrate a week ahead for me.
Perfect.
All right, now August, October, and December meetings. And all plans change when the first bullet's fired. So it who knows when we get to there, but any other discussions? We'll go with changing of April meeting from 7 to 14 and the March one from 3 to
10th.
10th. Yeah, 10th. All right, we'll just need a motion to approve these.
Motion to approve.
And I guess we'll go out in the second one then. All right, and all in favor? Any opposed for these dates? Thank you.
Thank y'all for working around that appointment for me.
All right, next we we'll just discuss some things on the bylaws and in past meetings. I'd love to have a quick summary on what it was,
Absolutely.
if you don't mind.
So what I wanted to bring to y'all, and we've talked a little bit about this previously, we had standing subcommittees for forever. This predated Adam, it predated Lillian, it predated pretty much everybody in this room. I went to a legal training for public health professionals, and there were several things that we talked about. And the person that did the legal training is a long-standing county attorney, she still works with boards of health, so she's in the know. Her recommendations were for all sorts of things public health, but one of the things that really jumped out at me is she's like, y'all don't need subcommittees, because as a public health board, you are subject to open meetings. So when you set a subcommittee, that becomes its own board in its own. So using these three gentlemen right here, if Commissioner Kester, Vice Chairman Odom, and Chairman Ellington are all on a committee together, and the two of them stand in the parking lot and have a conversation on something about that committee, they have now violated open meetings law because it is a standing committee. She said, don't do that. It saves you a bunch of trouble just by not having them. And that way you don't have to really sign up for one. But if we ever need anything, we could set up a committee. So the changes that were recommended included removing all of the standing committees, and we would just use them as needed. So if Justin Iphone wanted to talk about family planning hours and was like, we really need a committee to work on this, he could come to Dr. Ellington and say, I'd really like this to happen, and we could set up a standing committee for anything that y'all wanted to do to work deeper than what we're doing on the full board. Not a problem whatsoever. But by removing the standing, we get away from any potential conflicts with open meetings laws. There were some other grammatical changes. That was thanks to Belinda. She read through it and said, this reads better if we do this, put a comma here and some things like that. We also needed to change our meeting frequency because we used to meet every other month, and then we had a first meeting in January. And so Belinda was like, look, we've made some changes. We are not in line with our current bylaws. So we made it to be more flexible to meet the current way that we're operating with our meeting cadence. And then that's pretty much it. It was all, like I said, recommended after legal training with Deborah Bechtel. And so that's what we brought to you today. So nothing really substantial except for the removing of the standing subcommittees.
Yes, all of our subcommittees are important, but I guess the budget subcommittee might be the one that I'm thinking is probably the most intense. Which is why I stayed off of it these years. But what is that gonna look like at budget time?
So this year we didn't have one.
Okay.
The whole board looked at the budget.
Okay.
Y'all all went through it. You all were given all the documents, and so that it's really, I mean, we would say if there was something specific that we needed to speak about with anything, just sort of to plan ahead and make the agenda a little bit lighter so that we could dive in deeper on whatever topic that would be.
I guess that would just be more planning on the budget department to make sure that, all those, if we needed to have something come to the board first and, just so you don't get behind, I guess, on those hard dates. Okay, that seemed very doable there because that's the one I was thinking. I mean, to me, everything else is almost as easy to discuss here since we're not a huge board and we get on here. Okay,
And each year we do present it to our board. We turn it into the county manager and say, hey, this is it, but we still have a Board of Health meeting and they have to approve it as well. So we do have that working relationship that they know things could potentially change. So based on board input.
I just thought that would be one that would be a little more planning, to make sure that it gets those dates that are needed. That was the only kind of thing I had about it. Discussion on the bylaws, changes and recommendations.
So just to be clear, we're removing all subcommittees, all standing subcommittees. You can create a new subcommittee if you need to. It's just subject to open meeting law or whatever the lawyers call it.
That special meeting, would that fall under special meeting? If we do that in the future?
No, I mean, I think, well, special meeting would be as if you had a full meeting of the board that's unscheduled, that was previously unscheduled. But you could say, well, we're gonna appoint a committee, and create a committee, for a specific purpose, and and those people would be named the committee. I mean, to do that, you would have, it would be at a meeting like this, to create the committee.
I should say too, I wasn't very specific. The bylaws allow for at the beginning of the year, if you think like, the years that we were really struggling with environmental health, I'll just use an example. If y'all were like, look, we need to talk about environmental health in January, we need to set an environmental health committee. We're going to meet monthly. We're going to meet bi-monthly, whatever the case may be. We're going to set that up for the year. That's one option. Option two is at any point in time in the year, if something pops off and we need to discuss it, we can have a special committee. It would still follow the same rules with at least 3 members. You ask the chairman for it, but we have a way to have a committee that we designate to run the year or just something special that pops up. And then whoever was interested or was deemed necessary to be a part of it would be assigned at that point in time.
Yeah, I think just the biggest thing, and I think you're okay with that risk, is you lose your flexibility to move fast, right? Because you've got to wait until the board meeting, right? Unless you call a special
meeting,
right? Then you've got to set the committee up, subcommittee, whatever you want to call them. I think that's just kind of the biggest issue. So you just need to be proactive if that's what you're going to do.
Any other discussion? All right.
Mr. Chairman, we will need a motion to approve the bylaws as presented.
Before that, we do, yes, we still need a motion to approve as is. Motion to approve is written. And a second.
Second.
All right, all in favor? Opposed?
Thank you very much.
Just one thing Ryan mentioned, noticed as we're reading through all this is there stuff that's currently with committees that needs to be transitioned over back? If it's the committees don't have any current business going on.
We haven't had a committee meeting in a year.
Okay.
But thank you for that.
Yep.
Carried forward.
Okay. And then I guess when you guys go into closed session, I guess we don't do closed session all the time, but you all will always state on the agenda what the purpose of the closed session is. I think that's sufficient. I mean, that to make the public, whoever, aware of the reason why, because that's one of the requirements is that we have to state the reason for going into closed session. So that looks like you all already do that. So.
All right, and with that, we'll move on to the last item of new business, which is our health director's job description. It's in the packet. It's pretty much just to look over if you all had a chance to, if there's any changes that the board wanted to make on that. I haven't had anybody directly bring anything to my attention on that.
The health department does follow the OSHR jobs. So all of the parts about the training and minimum education is directly from OSHR, and that's pulled over. The rest of the items are, board directed. For example, when I became the local health director, it was added in there that the health director shall live in Davidson County. That's a residency requirement. That was a board directive, and that's in there. The other items are just carryovers from years and years and years, but the board sort of, before I became director, wanted to, they outlined this in the way that things should be. The previous health director was told that they were supposed to work here and live here, but they ended up not doing it. So it is codified in this, and I have to sign it every year. And it also does say if for some reason the health director needs to move, they have to get approval from the board to do that.
So basically, this is just a check item that we have to do every year.
Yes, accreditation says that y'all approve my job description every year, and then once that happens, I will sign it. Dr. Ellington, who is my direct boss, being the board, will sign it, and it'll go into my personnel packet for accreditation.
All right. No other discussion. We have a motion to approve the current job description of our health director.
I moved to.
And second,
I'll second it.
all in favor?
Aye.
Opposed? All right. Well, now I'd like to have a motion to move into closed session for what will be going over the qualifications and competence and everything of our immediate health director. Would like the board members remain for that closed session, and I will be taking the minutes for you.
Motion for the closed session, right?
Any second. All right, all in favor?
All right.
We're in closed session.
All right, if would email me back, or I'm sorry, send me a text message and let me know.
You want us in here, the attorneys?
Sounds like it's just the board members, yeah. So,
Okay.